Oh, hello everyone. Good morning. I'm going to talk about our recent work about minimum 10 years outcomes of hip arthroscopy with retroverted acetabulum, a propensity match study. Our disclosure is in the website of American Academy of Orthopedic Surgeon. So as a background, acetabular retroversion is, as everybody knows, is characterized by an abnormal orientation of the acetabulum, where the acetabulum tilts more posteriorly than normal. Various options have been suggested for the surgical treatment of this condition, including reverse or anteverting PAO and hip arthroscopy. The purpose of our study was to report and analyze minimum 10-year outcomes of patients with acetabular retroversion and FAIs who were treated arthroscopically. We hypothesized that patients with acetabular retroversion treated for FAIs and labral tears arthroscopically will demonstrate positive long-term outcomes and high survivorship. So we retrospectively reviewed our registry at American Hip Institute on preserving hip preservation on patients who underwent hip arthroscopy for FAIs and labral tears between 2008 and 2013. Retroversion was based on anteroposterior pelvic radiograph and the presence of an initial spine sign and more than 20% of crossover sign. Preoperative and minimum 10-year follow-up patient reported outcome measures, including modified Harris score, non-arthritic hip score, hip outcome score, sports-specific subscales, and IHOD 12, in addition to VAS for pain, was collected. Exclusion criteria was 20 grade over 1, prior ipsilateral hip surgery and condition, and workers' compensation status. Overall, 124 patients with retroverted acetabulum hips were propensity matched in a 1:1 ratio to 124 patients without retroverted acetabulum based on gender, age, BMI, Tony's grade, and LC angle. Rates of achieving the MCID and the PAS were calculated. Hip joint survivorship for conversion from total hip arthroplasty and revision hip arthroscopy rated were collected. So here we can see the result or demographics of our two groups, the matching groups. There was no difference between the laterality of hip, gender, age, BMI, lateral center edge angle, and alpha angle and Tony's angle between these two groups. They're completely matched. Mean age was 32.8 years and BMI was 24.8. The mean preoperative lateral center edge angle was 29.8, and the mean follow-up period was 10.3 years. Preoperative range of preoperative outcome measures shows at the end significant improvement in all PROMs from baseline to minimum 10-year follow-up in all patients. Greater IHOD 12 scores in the RA cohorts than the non-RA cohorts. And here we can see the clinical outcomes. Both the RA and non-RA cohorts achieved high MCID and PAS for each individual outcome. The retroverted acetabulum cohort demonstrated significantly greater achievement of PAS for VAS compared to the non-RA group, which was, this difference was significant, statistically significant. In terms of survivorship, 10-year converting to total hip in RA group was 8.1%, and in non-retroverted group was 10.5%, but this difference was not significant. Average time to conversion to arthroplasty was 76.5 months in RA group and 63.9 months in non-RA group. Revision arthroscopy, total undergoing revision ipsilateral arthroscopy was 7.3% in retroverted group and 13.7 in non-retroverted group. Average time to arthroscopy from the index procedure was 32.4 months for the RA group and 49.6 months to non-arthritic, non-retroverted group. So these are not significant statistically. The strength of our study was a long-term follow-up. There's not that much 10-year follow-up on retroverted acetabulum out there in literature. We were using multiple PROs and the use of clinometric threshold. Limitation, absence of a comparison to PAO group, single surgeon study, and the retrospective nature of our study, which makes the level of evidence as 3. Conclusion. Patient with acetabular retroversion with associated FAIs and labral tears can be safely treated using advanced hip arthroscopic technique without reverse anteverting periacetabular osteotomy. These cohorts demonstrate positive long-term outcomes and high survivorship, which compared favorably with a non-retroverted control group. Thank you and have a great day.